to address us on how we move to action to reduce health inequities.
Thank you, Kumanan. First of all, I'd like to say hello to all the old friends and congratulate Ana Lucia for this wonderful seminar. I think that Sir George was very eloquent and made some of the points that I wanted to make. However, I'd like to discuss at least 2 or 3 additional things. The first one is that I would like to stress the need to understand that it's not the same to talk about structural determinants than to talk about intermediate determinants, particularly when you talk about action at country level. Of course, for example, it is not the same when we talk about the level of economic development in a country than when we talk about the level of sanitation of the water. However, therefore, what I do need to stress is that in the conceptual framework that we are using is quite important, because the conceptual framework and to differentiate between structural and intermediate determinants lead us to different actions at different levels. The second point that I also would like to, and of course, as more structural as the determinants are, the level of action is much more political, and the difficulties of implementing that action is completely different. The second point that I'd like to insist is that this is not an issue of perception. These inequities and the way that the gradient works is not based on the perception of being lower or higher in the social hierarchy. This is a real issue of being lower or higher in the hierarchy. Therefore, the actions need to be based on the changes, the socio-political changes that will make the gradient to decrease in terms of the society, in that particular society. I also would like to discuss a little bit what Sir George said regarding the intersectoral action for health, and I'd like to illustrate this with an example. The issue is not necessarily working with other sectors to achieve common goals. It depends, because when you really have a whole state working towards a specific target, let's say working towards, and let me put this example, universal health coverage, not necessarily the sectors need to work together. In fact, when we did a review while we were working at WHO on the countries that basically had best health indicators at low cost, all those countries share in common that the common goal of the whole government was health at low cost. However, the different sectors work on a very vertical way and within their boundaries to achieve that goal. What I'm trying to say is that the way to work within different sectors had to do with the a specific objective, and if there is need or no to articulate the different sectors and at what level. And I think that even though we have written and spoke a lot about intersectoral action for health, still is a specific phenomenon that we do not well understand in terms of the different ways of action. And finally, I'd like to say that, and that is also from an earlier comment, that I don't agree that what we have to do is to create capacity building, because what really happens is that there is no capacity very well developed in any place in the world. So at this point, I think that what we can do is we have to try to implement different actions at different levels and try to learn together. I had the privilege of being part of WHO during the time of the Commission and being in charge of the Secretariat, and then I had the double privilege of coming back to my country and being nominated by the President as the Vice Minister of Public Health. And what we have done during these years in office is to try to work on concrete ways to follow up on the work of the Commission of Social Determinants of Health. And the first lesson that we have learned is that it's not easy. That, for example, trying to put a core set of indicators that include equity, it's a lot of work. And that the work begins with having a conceptual framework that is shared. What has taken us the most part of our time is to be able to develop a common framework that we all in public health agree. The second thing that we have been trying to do, and we are just seeing some progress, is on developing this core set of indicators, first at regional level and second at a community level. And then what has been probably the most difficult part of the work is to try to incorporate the community in our planning. And we have done that using a strategy that is to build a strategic objective for the decade using a strategy of forum from community to national level, and it has taken us almost a year to be able to develop this initiative. And then the most difficult part is to create change inside the Ministry of Health. In particular, we have been trying to focus on redesigning the priority public health programs to be able to really reach those that we never reach. And in doing that, which means basically, first of all, trying to diagnose what are the access, the barriers to accessing health, and secondly, try to see how do we reach those that we are not reaching. That part of the work begins with having the staff at the Ministry of Health convinced that that is doable and that in fact we are not reaching those that are in greatest need. Because even though we read about the heart paradox and all that, people don't visualize it at in the general or in the classic way that we do our programming. So, just to conclude, I think it's important to emphasize the need to learn together, to try to implement what we have studied and discussed with different governments. And I think that in that way, in that particular area, WHO and PAHO have a major role to play if we really want to go from talk to do. Thanks.
Thank you, Dr. Vega, for that contribution, which has really shown a country that is moving forward from the recommendations of the Commission, but also that clear identification of the difficulties in doing so, and the fact that health and all policies and intersectoral action is complex, that there's not one way, that there's different sorts of intersectoral action, and the need to understand that and understand which sort of intersectoral action is most applicable. So I just want to apologise that we've gone a little bit over time. We have two more excellent speakers, and obviously this has been the first session. We have 104 people connected online, and so obviously the technology is a little bit difficult to set up, but we're really going well now, and I'm sure the rest of the day will be a lot smoother. So I'd like to now move to our next speaker, Dr. Bernardo Klicksberg. Many of you will know him. He's currently an advisor to the UN Development Programme, and he's also a director of the UNDP Spain Fund. So I'd now like to ask Dr. Klicksberg to give us his thoughts. Thank you.